This one's called The Patient. This story happened in a hospital a few years ago. Patient was waiting for a bed to become available up on one of the floors. So while waiting, they had placed her in a room. There was a camera in there. She was being monitored. She was under an order that prevented her from leaving, unfortunately. There was concern that she might be a danger to herself. So they put her in a room. The door was not locked. She was free to walk around the room, come out of the room, talk to staff, use the bathroom. So as the evening was winding down, everyone was in their beds. All you could hear was the noise of the occasional phone ringing nearby at the nursing station. A little bit of chit-chatter amongst the nurses. And you can hear people once in a while walking down the hall, transporting patients, people cleaning rooms, hallways. It was a normal night. But then the clerk at the desk had a gut feeling that something wasn't going to be right that particular night. And boy, was she right. Sometimes the patients would approach the desk and ask for water, sometimes for a book, an extra pillow maybe. So most times they would just ring a call bell, but some patients would, if they were ambulatory, they could walk over and just to socialize a bit. And this one patient in particular walked over and asked her if she could have a pen. Now, according to her chart, that was not something that they could give her. And the clerk told her that she couldn't accommodate her at that moment. So the patient walked back to her room. Now, there was a security guard sitting right next to the clerk to the right side, and there were 6 rooms in that one ward downstairs in the ER, and every room had a camera, so the security guard was monitoring, making sure everybody was safe. A couple of times the clerk would look over, and on the screen, this particular patient, we'll give her a name. We're going to call her Harriet. So Harriet would often be standing near the bedside or pacing in her room. Sometimes she'd sit down. She'd come out of her room. She'd walk towards the desk, walk away, walk back into her room. This happened pretty much for a few hours that evening. So the clerk was starting to feel a little uneasy because she just sensed something was not right. So at one point during the night, things got really quiet. So Harriet walked over. You can see her off on the monitor off to the side, her coming out of the room and walking towards the desk. And she came over and asked the clerk if she could have a pen again. The clerk said, "Look, I'm really sorry, I can't give you a pen." She goes, "Well, I need to write something." So the clerk looked over to the nurses and they said, "You know what, just give her a pencil or something and she's just going to write some stuff, give her some paper and she should be fine." Okay. So clerk gave her a pencil, gave her some paper. Harriet was really appreciative. So she walked back to her room and you could see her writing and just writing, a little sketching. And here's where things got really interesting. Shortly after, Harriet came out of her room. She was walking out, and you can see on the monitor, she suddenly crouched down. So you could see Harriet slowly approaching the desk. Now, the only person that saw her at that point was a security guard. The clerk wasn't aware yet. But then the security guard nudged her on the arm and said, "Hey, just brace yourself. Don't freak out." He says, "Our friend's coming to say hello." And the clerk lifted her head up from her computer and looked around. So the clerk got really freaked out and said, "Oh my God, what is she doing?" And the guard says she's just crouching down there. She has something in her hand which looks like some paper. So slowly Harriet started to come up from her crouching position. And up came this piece of paper with a sketch on it. And it's a sketch of a girl. And the girl's got a smile on her face. There's the sun in the corner shining. There's a picture of some flowers. But near the abdominal area of this sketch, there's what looks like a sad face, grimacing a little bit. So the clerk kind of just, watched that and said, "Harriet, that's really nice. Do you want to share a little bit about what you just drew there?" So Harriet pops up really quick and says, "Yeah, that's me." And we're like, "Well, that's a nice sketch." And she said, the clerk says to her, "Oh, you got the sun shining, there's flowers, you look really happy there." She goes, What's that there near your belly?" And she said, "Oh, that." She goes, "Oh, that's him." So everyone kind of looked over towards her, including the nursing staff. When the nurse came over and asked if everything was okay, everything was fine. And the nurse said, "Hey, what did you draw there?" And she goes, "Yeah, that's a picture of me and that's him." Well, nurse asked her, "Who's him?" And suddenly Harriet became very closed off. She got quiet. Her facial expression changed a little bit. And she walked away from the desk really slow and back into her room. But she just stood there at her bed with her back towards the camera. A few of the nurses had gone on their break. There was a minimal staff there at the desk. Things were all under control. The security guard was looking at the monitors, looking at his phone. Once in a while he'd look up and look around. The clerk had gone on her break. A couple of minutes after, Harriet got up from her room and walked over to the desk and asked the security guard where the girl had gone. And he said, "She's on her break right now." And she said, "Well, when's she coming back?" And he replied, "She'll be back in a little bit. She's allowed an hour, so she's been gone for about 15-20 minutes, so she'll be back soon. Is there anything I can do or help you with until she gets back?" And she said, No, I've something I want to show her after." I said, "Okay." So she walks away, walks back into her room. Again, standing at the side of her bed, with her back turned to the camera. So eventually the break was over and a couple of the nurses came back. The other nurses went on their break. So the clerk had come back from her break, sat down in her desk. The guard had gone to get a coffee. A couple of nurses were coming off break. A few were coming back on. Suddenly, there was a cool breeze that flowed right past the desk. And the clerk felt that and thought, "Oh, that's weird." So the guard came back, put his coffee cup on top of the desk, looking at the monitors. He doesn't see Harriet in her room. So he stands up and he says to the nurses, "I gotta look for her. I don't see her in the room." So he walks into the room and she's not on the bed. So he walks out, knocks on the bathroom door, asks for her a few times. She doesn't respond. So he asks the nurse to come over and help him. He's going to open the door. She's going to go in and check, make sure she's okay in there. Well, there's nobody in the bathroom. So he's starting to get a little worried. Now the nurses are starting to look around, and he goes back on the monitor. He rewinds the tape. He sees her in the room, and then she's walking towards the door in the video, and then suddenly she just is not there anymore. So the security guard alerted the other guards by radio that there may be a potential patient missing. So they called a code yellow, and up here this is what they call the missing patient code in the hospital. It is a code yellow. And they started to frantically look for her. It wasn't a big room, but there's enough places you could hide if you wanted to. So no one in the bathroom, no one in the other patients' rooms. But then the clerk notices something just slightly off to the left. Now, right in front of the clerk and desk station there, the nursing area, there's 2 rooms there, like exam rooms. They don't have doors, they just have curtains. Clerk looks over and realizes that one of the curtains is slightly moving by itself. So the guard called out and asked her if she was behind the curtain, that he was going to open the curtain. So as the guard and the nurses are walking towards the curtain, they can hear someone humming like a song. So the guard calls out and says, "Harriet, is that you back there?" There's no response. He said, "Harriet, I'm gonna open the curtain up. Are you okay?" And as he's moving closer, this all happened within a few seconds. As he's moving closer, he says, "Harriet, I'm gonna open up the curtain." And as he pulls the curtain back, there she is, standing on the bed, drenched in blood from head to toe, gown all soaking wet, red, hair all tangled up, blood everywhere. And she hisses out at them, "You'll never take her, she's mine." She's making these high-pitched sounds, but she's all covered in blood. Apparently the pencil, she broke off the tip and somehow made her way behind that curtain and started to stab herself and started to gouge herself in the face. On her forehead, there was blood running all over down her face, all over her gown. She fell down on top of the guard and tried to scratch him. The nurses were trying to pull her off. There was a big struggle happening. They were calling for backup. It leaped up on top of the nursing station desk and started screeching. They tried to bring her down off the desk. She wouldn't come off the desk. Her voice changed slightly. She didn't sound like the Harriet from before. Everyone was freaking out. She crouched over on top of the counter and started walking like a tiger and growling at people. She leapt off the counter, landed on the floor, charged anyone that was in front of her. She knocked 4 nurses down. 2 security guards tried to subdue her. She reached over and scratched them in the face. They started to bleed. Finally, a few guards and a couple of nurses managed to hold her down. Nurse brought over a sedative. So they put her on a stretcher, brought her into one of the trauma rooms, and started to work on her. She didn't come back into that ward. She was taken directly upstairs to the floor. But that was one night they'll never forget.